Hello, and welcome to the Inside Scope, a podcast from Lakeland Regional Health where we share insights from experts providing award-winning care right here in our community. I'm Dr. Daniel Haight, Vice President of Community Health here at Lakeland Regional Health. And with us today are two specialists in a very critical area of medicine. With me today is Dr. Flores and Dr. Croci, who are both neurosurgeons here at Lakeland Regional Health. And I guess I want to start off with something that we almost see every day, an ambulance speeding either towards something that's happened or speeding towards the hospital. And my heart just goes out to what could possibly be going on. And they are headed towards Lakeland Regional because we are a place that deals with trauma. Tell me a little bit about what's going on when that ambulance is headed your way.
Well, a lot of things can cause the risk that the ambulance run to the hospital. Basically, sometimes we have a trauma to deal with a trauma. Sometimes it is a patient is suffering a stroke. But what we see often here are traumas, and sometimes it can be a motor vehicle accident or a car accident in which somebody gets injured, and sometimes they can suffer such a traumatic brain injury.
Because I know when these traumas come through, they could have injuries that are just a multitude of injuries from the feet all the way up to the chest and to the head. And being neurosurgeons, you're focused a lot on what comes in. But what are some things that you feel that we have that kind of, what's the advanced care that's available at a trauma center?
Well, the advantage is the team. We do have trauma. That is a primary team that receives this patient. We come from the ambulance, and also surveyed by the ER physician that do a very great job in stabilizing these patients. And then if it involves the brain or the spine, then that's where the neurosurgeon comes in play.
You know, I've often heard, and when I'm in the hospital, it actually starts before the ambulance arrives. I'll hear them announce it within the emergency room team because as we're treating other patients, there's an alert that goes out. Is it called a trauma alert?
Yes, correct. It's a trauma alert. Usually, when an accident happens, the EMS get called in, and there is where the treatment of the patient starts.
Oh, so the ambulance is calling ahead as they're treating, stabilizing the patient, rushing them safely to the hospital trauma center here at Lakeland Regional. They're alerting you. Are they giving you any information ahead of time as the patient is not there yet? But what kind of alert do they give you ahead of time?
Yeah, that's a great question. Yes, it started with the trauma team. Actually, they call us because they already surveyed the patient. They have the trauma alert, and then
they're ready and waiting, right?
Yes,
They're ready and waiting.
They're waiting in the trauma bay. That's what we call it. And then they just knock the door because we work with them in same near office. And then, hey, Dr. Croci or Dr. Flores, there's a case with a brain injury. We might call you because of this or a bleed in the head or a spine fracture, and then we get involved.
And so I can understand that trauma bay is that room where the patient first arrives after the ambulance. And I noticed that it's really set up. Well, one thing, it's warm. Yeah. I noticed that. Why is it so warm in the trauma bay?
Because, this patient arrived, they suffer severe trauma, they might have some blood loss, and their body temperature might go down. In Florida, we're lucky because it's pretty hot, but otherwise, the patient, they come in, actually, sometimes we have to remove the clothes of the patient for certain procedure, and that's why the room where the patient comes in is very warm to keep the temperature of the patient.
And when you're seeing these traumas, are you seeing a pattern in our community of traumas that might be preventable or ones that require a lot of extra care?
Yes, actually, what we notice, we see a lot of motor vehicle accident, especially a motorcycle accident. And unfortunately, we saw a multitude of young patients that suffer a simple motorcycle accident without wearing a helmet, and that they come with some severe traumatic brain injury.
And we were even talking before about, the protectiveness and things. It's a combination, right? It's speed, what actually caused the impact, but then it's what are they doing to protect themselves. And in our most precious is our brain. And what with the helmet, are you seeing extra protections when a person is wearing a helmet?
Yeah, absolutely. Having a helmet is like a protection barrier. Our skull, right, protects our brain. It's a closed box. The same thing. The helmet protects our skull to avoid further injury if you have a traumatic or fall from a bicycle, a motorcycle, or even a scooter too sometimes. And now they have electrical scooters. They very high velocity.
Yeah, and some of those electric bicycles go pretty fast, and you get a little extra confident. Yeah. But I noticed when we hear about sad cases where someone did not survive a car crash, and often it can be through chest trauma, head trauma. But I also think, what about the folks that survived, but they are left with ongoing injuries? What do you see after head trauma?
Well, in fact, even the patient that come and they are alive and we treat them surgically, they have an extremely long recovery, most of them. Some of them spend 2 to 3 months in between hospital and rehabilitation clinic, and only 20 or even less % of the patients suffering this type of injury are able to come back to a normal life within the first 2 years after trauma.
You know, and when you're working with a family member and you're trying to help the injured person to recovery, what are some of the common questions that you actually wish are being asked, and you make sure that they try to answer? What are some common questions that a family member asks?
That's a great question, because like Dr. Croci mentioned, the injury is not only for the patient, it's also the family burden. And most common question to ask is if he's going to be independent, how going to take care of him, how we're going to feed him, how going to have to shower him. There's a lot of questions ongoing that they just unknown, because depending on the severity of the brain injury.
Yeah, I keep going back to just when you see an ambulance rushing to the hospital and there's a soul inside needing help. It's not just them. It's the family members. It's where they worked, people that had relied on this person who is having their moment of emergency. And if it's a car crash, anything that could have been done to be better able to survive. Yeah. But you think about that, and so you bring up a good point. Like, what do you say to the family, and what should the families be thinking about the key questions? Any other questions you think that, when you meet with families, what are some common questions, or questions you think, this is very helpful to raise their knowledge up?
Well, one of them, when we have to deal with a severe traumatic injury, the first question that a lot of family members ask us, is he going to survive? Mm-hmm. And that's always a very difficult question to answer, because we know that the first 48 hours after trauma are very critical. It depends all we are able to rush the patient to the operating room, because the early we do, for example, if a patient has a major bleeding and we have to take it out, the early we take it out, the better is the recovery. But even after that, it takes time to see how the patient is going to do.
You mentioned this comprehensive nature of a trauma center. So at Lakeland Regional Health, when the patient arrives and they have neurosurgeons waiting and you're there for those issues, but you said that first 48 hours, so it may be after initial surgery, the intensive care unit. Tell me a little bit about the trauma intensive care unit, because it sounds like they've got eagle eyes. They're constantly watching. What are they watching out for, and why is it so important to be in a trauma intensive care unit?
Well, that's a great question. So, like he mentioned, everything starts in a fast pace. We treat the TBI, traumatic brain injury, as fast as we can. But then there's a period of brain swelling that sometimes can occur after a brain injury.
And it may happen right away, or you're saying that it could also be delayed by hours?
Yeah, delayed by hours, or maybe 1 or 2 days or 3 days. So in that time, the trauma team is the most important player in this care, because they're watching him with neurological examination every hour. They're giving medication to make sure the brain swelling doesn't go out of control. They're making sure, sometimes we have to put like a measure pressure to the brain to measure the pressure. So every treatment is tailored or based on the patient need. Yeah. So that's what I mean. It's important that all this happens in the ICU.
Yeah, and that's constant monitoring. And sometimes I get frustrated by television as you sort of see the kinds of observation that it's much more intense in real life. And when you just see them flash a little, a light in someone's eyes, but they're looking for brain swelling. They're looking not just in one spot, but they're examining the whole body to make sure if there's brain swelling. What are some things they pick up in the intensive care unit?
Well, first of all, we have to also consider that actually the brain is the place in the body which control the rest of the body.
Heart, everything, yes.
Exactly. So even if a patient just has a single isolated head injury that can affect every single organ in the body, the heart, the lungs, and so on. So when a trauma nurse or physician come to see the patient in the ICU, they're going to do a thorough exam of the entire patient or all the organs and multiple times a day.
Oh, exactly. In fact, I know often patients who have had a severe trauma and the brain is involved, they're actually given some assistance in breathing. So they might be on a breathing machine just to help protect them that only air gets in the lungs, but they get enough oxygen. And that's a very careful process that they're all about in the emergency room and in the trauma center.
Yeah, and I would like to add, you just mentioned the most important word, oxygen, because when you have this brain injury, the brain what requires oxygen, so there's no more other injuries in that period of brain swelling.
Yeah, and that brings up another topic that's not trauma, but when the brain gets injured, it's often because of lack of blood flow or the blood flow is not going in the right direction where a blood vessel has broken. And I can imagine that's more of a surgical issue, that if the brain's not getting blood, what do they say? Is the brain's not getting blood, the brain's dying. So what are some things that happen right away if there's a stroke where there might be bleeding?
Well, the first thing we see actually, the patient alert status decrease. The patient becomes more lethargic, more somnolent, and it's difficult to awake the patient.
Hard to wake them up.
Exactly, hard to wake them up. And this is one of the first signs. Maybe the patient's not able to move one side of the body, is not able to answer simple commands. And these are all signs that implicate there is something going on in the brain. The brain is not getting enough oxygen.
Excellent. And, that's something where family members have played a huge role at recognizing it soon, because sometimes the person themselves can't really say anything. And then we try to get folks to recognize the signs of stroke and to get to an emergency room like Lakeland Regional.
Yeah, and I would like to add something that you have mentioned, and most important, how the family member involvement is crucial for patient care. I think it's ultimately crucial because unfortunately, there's some patient that comes with this trauma to the brain. They come alone, so it's hard to convey this message to somebody. And then having a family member makes a dramatic change in the patient care, because it's making it easier. We can guide treatment based on what the patient want if he was her in that position. So that's why I think the family is one of the most important key in this patient care too.
Because they can really observe changes in the patients, and they're going to be learning a lot about how best to care for their loved one as they go through this recovery, which we hope is a speedy recovery. But as you said, that first 48 hours, you're watching closely to see how well someone's going to recover. Excellent. Oh, that's incredible. Well, I think that's been, a couple of things where we've got a comprehensive trauma center, but it's a team. You mentioned, in addition to your services as neurosurgeons, what are some of the other team members when a trauma alert comes or a stroke alert comes?
Well, there are so many people involved from the beginning of the care until the end. If you think about it, when the patient come in, we have an entire staff of nursing from the ER, a physician from the ER taking care of the patient, the trauma physician, our nurse practitioner, Stacy, Kyle, Jessica, Alisa. They're all people that actually go and see the patient as well with us, and sometimes they have to put drain inside.
And anesthesiology, which is making sure you safely get to that. It's a complicated surgery, so anesthesia is going to be a key part.
Exactly. So it's really an ensemble of multiple people together. I think, for every patient, I know how many people that care for the same patient, but a lot.
Well, I know families mention that it becomes where you're meeting so many doctors and nurses and radiologists, and it is something to see that care all happening at once. And that's where we encourage family members to ask questions, write your questions down. You mentioned some good questions to ask and be prepared. But we are just blessed to have you in our community and Lakeland Regional, getting that trauma care close to home. That's really critical.
I think that's been important because we have mentioned that the trauma care is not alone. It's a team effort. And us as a neurosurgical service, we are depending on everybody, including, like he mentioned, our nurse practitioners are like our right hand or left hand, whatever hand they want to pick. But the point important is that we work together, and that's the best way we can take care of our patients. Yeah.
Certainly, it is trying to get the assessment of our community, find out what's most common causing trauma, and then also working at the prevention, preventing drownings, getting car safety seats in place, seat belts, anything that encourages it. And as you really emphasized, how much a helmet can save, from injuries and other damage. That was key.
Exactly. So I think that's very important to prevent it. Some of the trauma are preventable. Some are not, but some are preventable. Or at least you can decrease actually the severity of the trauma. And definitely wearing a helmet when you are riding a motorcycle or even a bicycle or a scooter.
The electric bikes.
The electric bicycle. Yeah.
That helps. But again, thank you so much for the information. And we will have other topics in the future. This ties into a lot of what is happening here in Lakeland and what the healthcare services are needed when you need them, and they're right here close to home. So
I appreciate your time.